You know, ladies and gentlemen, I think if you, click into one of those forms and you say accidentally send on that kind of data, oh, man, who knows where that's going to go. And, again, the FMCSA does not require you to do all those things that I was mentioning, but you think about the stress level. If something like that happened and you send your information, keys to your kingdom off somewhere, good Lord, say a prayer, but it's also going to be raising your anxiety and your blood pressure, causing heart issues. And what a great segue. Dr. Fahmi Farah is on board with us now, one of North America's leading cardiologists. And Dr. Farah, it's great to have you back on the radio. Thank you very much for joining us on the show. Looking at stories like this, we are, I think, as Americans overall, simply overstressed, overworked. We're falling victim to these scams that are out there. That's going to raise your blood pressure, cause palpitations, and you might say to yourself, well, why did I get up this morning? Am I correct in that? How are you? Nice to have you back.
Always great to be back on your show.
Yeah.
Totally agree. Yes, stress is definitely a factor, and I do believe that we're overstressed. I totally agree with that.
And from the standpoint, I don't think really there might not be anything really we can do except to be more aware. But it seems like a lot of these outside variables just come into play almost like right there. Something happens. Do you find that a lot of people, when they're dealing with stress, they don't handle it well, or they do handle it pretty well? What's the best way to regulate your heart during stressful times? What would you say there?
I think the best way to regulate your heart during stressful situations is like deep breaths. Try to calm yourself down. Try to take yourself away from whatever that trigger is that's stressing you out. So identifying that is very important, and just deep breaths and removing yourself from the situation. That'd be the best way in the immediate setting.
Okay, so try to back out of it as soon as you can. But if you realize maybe some damage has been done, say you're in a recovery mode now, trying to protect your name and your credit info and all of that, maybe just talking to somebody that maybe is in the know as to what to do maybe can help alleviate some of that stress. Do you find that maybe folks that are in stressful situations, that they find a mentor, somebody to talk with, that can help calm somebody down to some extent, right?
Oh, absolutely. I think communication is very important. Having a counselor or a therapist is always advisable, and it's a very healthy thing to consider, to express or vent your frustrations and just have some guidance. A lot of times people are stressed out, like whether it is in personal life, relationship, or at workplace, because you're just kind of holding things in, and that communication gap is there. So just having open, honest conversations, expressing yourself, what's stressing you out, and just facing it and, addressing it sometimes is the best tool.
All right, absolutely. And when you find that somebody is maybe in a very stressful situation and they need to maybe control their heartbeat, maybe regulate it better, what do you do right out of the gate? What do you do to maybe help them bring that heart rate down, calm them down, so to speak? And it sounds like that might be an emergency room situation. But what are your thoughts on that? Where would you start?
Of course, on your own, again, remove yourself from that situation. Think of thoughts like calming thoughts, maybe listen to the music, deep breath. And, you're right. There are times when it is out of your control, and that anxiety can lead to high heart rate and quickly can turn into something called panic attack. And honestly, a lot of times those triggers are not in your control. And we do see quite a few people coming to the emergency department in the setting of panic attacks, because a panic attack can very much feel like a heart attack, and sometimes people don't have that control. So my advice would be, before it gets to that level, try to contain yourself. Try to address it before, remove yourself before it gets to that situation, because there's a threshold. Once that threshold is met, you really lose control over whether you're going to have a panic attack or not.
And what is a panic attack exactly, doctor? Is it simply where you just feel like the world's spinning out of control, heart rate goes up? I know somebody very close to the family that goes through that. and especially like when they're in a work environment, I should say, and they completely shut down. They can't function, can't work, can't communicate. Kind of a scenario. Does the brain just take over at that point with a panic attack?
It very much so does, yes. A panic attack is where you're right, your heart rate will go up very high, blood pressure typically goes up, and people tend to have other symptoms with it, like they'll actually have physical pain. Like a lot of times people feel physical pain in their chest area, so they'll have chest pain, and they will have shortness of breath. They feel like they're suffocating, like they can't really breathe. A lot of times people actually describe it exactly as heart attack symptoms. They'll feel like something's sitting on their chest. A lot of difficulty breathing, sweating, like profuse sweating. So very much synonymous to a heart attack scenario in terms of symptoms and signs.
Drivers, let me invite you on board if you want to jump in with Dr. Fahmi Farah, one of North America's leading cardiologists. Not here to diagnose you over the phone, obviously, but to give you some great information as to what you need to do. Do you have panic attacks? Is that something that maybe you experience, maybe on an infrequent basis, or maybe is it quite often? Give us a call. How do you handle something like that if you're going through a panic attack? Have you been diagnosed with one? Or you just simply might just say, well, it'll pass. This too shall go. Kind of a scenario. Call us, and Dr. Farah will talk with you. Doctor, do a lot of people just simply say, well, maybe I'm going through a panic attack, and this too shall pass? Kind of a scenario?
They can. Typically, though, when it reaches to that level of full-blown panic attack, most people don't say that. They really feel like an impending doom, like they're dying. And most people, when they're having panic attack, they do end up in the emergency department.
Okay, so they feel the world's really closing in on them. And this is kind of, I think this is probably one of the most important things. Have somebody maybe that you can call. You know, if you're out there on the road, drivers, who's your support system? If you feel you're going through such anxiety levels that, man, it's just creating a lot of problems. We're going to break Dr. Farah. Hold on. Dr. Fahmi Farah is on the line with us talking about panic attacks and stress. We're going to be back in a minute. SiriusXM 146. Number one.
We now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
Drivers, hey, I want to welcome you back. And, have you ever had a panic attack? Oh, man, when you're out there on the road, it's something that can really get out of control. Dr. Fahmi Farah is on board with us, and we're talking about heart health and heart wellness. It's one of the subject matters I've got going on with her. And, Doctor, again, thanks very much for joining me on the show. Hey, let's get your website out. Where can folks find you?
You can find me at www.drfahmifarah.com, also at Fahmi J. Farah on Instagram and Twitter.
Outstanding. Thank you very much. And, speaking of stressful situations, school's back in Dallas-Fort Worth. That's creating a lot of stress, I know, for a lot of the kids out there that are going back, books in hand. I saw several of them going down the street this morning. Do kids experience this as well? Panic attacks? A lot of the drivers have children. A lot of the listeners have children. Do they experience it?
They definitely can, yes. Even children can have anxiety and panic disorder. And the symptoms will be very much similar. They can also have they can have a hard time breathing, change of color, become very red. Children can have other ways of expressing as well, like behavioral issues where they will withdraw and not be able to do things that they normally do. They regress in their behavior and then progress a little bit.
Okay. Does this also mean that for, say, the adults that are working, say, outdoors, that if they're going through a panic attack and maybe they don't judge the weather elements correctly, like the heat, for example, can you lose focus in that regard? Would this maybe make you more susceptible to heat stroke, heat exhaustion this time of year?
They can. This time of the year, especially in areas like Texas, the heat is just so high. Typically, it's always above 90 degrees, and especially when it reaches over 100, that risk goes up tremendously. So, those who are playing sports, kids, getting back into sports have to be very careful to avoid prolonged exposure, and hydration is just so important.
How do you handle stress? I know you mentioned that you, of course, have done ballroom dancing before. And you've got a very difficult job, taking care of people. It's incredibly rewarding, but also difficult at the same time. How do you manage your stress level? What do you do?
Oh, absolutely. I have a very stressful job. You're right. I find things that I enjoy doing that would be a good outlet. And for me, dancing is excellent because it gives me the workout, the exercise, and it takes my mind off of everything that I normally do. So after, I typically dance 1 to 2 times a week. And,
okay.
So it's like at the end of a very busy, stressful day, the moment I walk into the dance studio, it's like all that stress is left behind, and that 1 or 2 hours that I dance for, it's completely stress-free. And so that's what keeps me sane, I feel like, a lot of times.
Oh, absolutely. And I would imagine that some of the advice and recommendation that you've given to your colleagues is pretty much along the same lines, right? Find something that is going to distract you from that stress. Have any of your colleagues joined you in the ballroom dancing?
Not yet, although I'm trying to convince my sister, who's also a cardiologist, to kind of join the team.
Oh, that's interesting. And your sister is a cardiologist as well. Is she in the Dallas-Fort Worth area as well, or somewhere else?
She just finished her training, so yes, she's just moved into the Dallas-Fort Worth area, and she'll be working here starting October. So.
Wow, that is fast. That is exciting, and congratulations there. Now, let's get the name of the place that you are the CEO of. You're the founder of Bentley Heart, correct?
That is correct. It's called Bentley Heart Medical Center.
Okay. How did you come up with the idea? And I think this is going to be a really fascinating story. How did you come up with the idea to start a cardiology hospital, if you will, treatment center?
Yes, you're right. It was an enormous undertaking. I come from a family where I grew up seeing heart disease. So I grew up on the other side, being on the table and the chair, sitting with a patient, like family member being the patient. So I kind of know what it feels like to be on the other end. And my reasoning for opening my own cardiology clinic is to be able to provide completely personalized care to patients, because I feel sad that nowadays, I feel that healthcare has taken a different turn where it's number-driven, it's corporation-driven, and I'm not so fond of that. I'm still old school in terms of what kind of care I provide to my patients. I like having very personalized relationship with my patients, and so my approach is slightly different in that the art of and the science of medicine should be preserved, and so that's the reason why I went for this.
Doctor, the audience that you're speaking with are mainly over-the-road truck drivers, and unfortunately a lot of them do fall into this category where they've got some kind of heart disease going on, or they're on some kind of medication to control blood pressure and things like that. It's a very sedentary lifestyle, and that's why that I feel that one of the most important things we can do for the audience is to provide this kind of medical information to the drivers so they can be proactive. At the end of the day, if somebody's listening, they're listening to this and they're able to get that little bit of information from the show or an interview, and then they can take that information on to their doctor to take it a little bit further, then we've done our job, right? We're doing well by providing this. What do you think?
Absolutely. I couldn't agree more, and I'm so appreciative to you for taking the time to create this show to raise awareness and inform and educate as many people as we can. And yes, the drivers who are, especially the long-distance drivers, they truly fall victims to this sedentary lifestyle. And I know it's very difficult when you have hours and hours of driving, you're tired, and becoming active and leading a healthy lifestyle could become very difficult. So that motivation is so important.
Doctor, when you are treating somebody, do you find that as far as heart disease goes, cardiac problems. It's an equal opportunity situation, or do men experience this more than women? How do you see those numbers statistically?
Statistically speaking, heart disease is the #1 killer for both men and women. Recent studies have shown that women fall victim just as much as men, if not more. It is the #1 killer for women as well. In the past, it was thought to be more disease for the men. That is not true. In fact, recent studies have shown that risk factors like high blood pressure, for instance, it damages the cardiovascular system in women sooner than it does in men. So I don't think that women should be ignored when it comes to treating for heart disease, and they require and should be given equal opportunity and equal attention when it comes to the realm of cardiovascular disease.
All right, very good. Doctor, thank you very, very much, as always, for joining us on the show. That's Dr. Fahmi Farah, one of North America's leading cardiologists. And, Doctor, thank you very, very much. And before I let you go, one more time, where can folks find you on the web? Can they call your office directly? What's the best way?
Yes, you can call our office at Bentley Heart Medical Center at 817-720-5185, on our website at www.drfahmifarah.com, and on social media at Fahmi J. Farah, Instagram and X.
You know, Doctor, I'm just thinking, once your sister gets settled in, would be really a lot of fun to have her join you for a 30-minute segment on the show to talk about the things that, she wants to accomplish, and how great it's going to be to work side by side with you. What a great story there. Doctor, thank you very much for joining me on the program, and we'll talk again soon. It's Dr. Fahmi Farah